Namaskar. I, Dr. Varun Patel, hailing from Ahmedabad, intervention, allergy, sleep, and failing lung specialist. On this COPD days, let's know about what is a COPD. COPD is the third highest cause of death worldwide in India and is the second highest cause of death in a non-communicable diseases. We know how the COPD occur is because of the polluted environment, smoking, chronic infection, etc. So one of your relative or a close friend or near and dear who are suffering from the recurrent chest infection, breathlessness, cough, shortness of breath, chest tightness, go and consult the doctors and get started a treatment, because the prevention is the cure and early treatment to prevent the complication. On this World COPD Day, I join hands India against COPD, take initiative and take the control.
Hi everyone, I'm Dr. Arjun Khanna and I head the respiratory services at Amrita Hospital, Faridabad. On the World COPD Day, I want to bring to your notice that COPD is one of the major killers in our country. It is a leading cause of respiratory morbidity in our country. A lot of cases of COPD in India are due to tobacco smoking, environmental pollution, and also due to the biomass associated exposure in India, which is extremely common, especially in the northern Indian states, where a lot of women are exposed to chula smoke and angithi smoke. On this World COPD Day, I join hands for India against COPD. Let us take initiative and take control.
Hello friends, I am Dr. Vishweshwaran, currently working as a consultant interventional pulmonology at Yashoda Hospital, Somajiguda in Hyderabad. We all know that COPD is a chronic obstructive pulmonary disease and it is caused primarily by smoking, pollution or by occupational exposure. So it is characterized by persistent coughing or tightness in chest or breathing problem, and any time if you see any of your friends or relatives, or if you are suffering from chronic cough that is persisting for more than 2 weeks in presence of an exposure history, then make sure that you are not suffering from COPD. This is because COPD is the third most common cause of death worldwide and it is the second most common cause of a non-communicable health disorder. On this World COPD Day, we pledge India against COPD. Let's take initiative and let's take control. Thank you.
I'm Dr. Rajam, a pulmonologist and palliative care physician from Mumbai, attached to the Bhatia and the Hinduja hospitals. COPD is the world's third leading cause of death, and the diagnosis of COPD can be extremely difficult as it's a progressive condition. And we really need to give holistic care for our patients, which also includes palliative care and improve their quality of life. On this World COPD Day, I join hands and pledge for India against COPD. Let's take charge and control, and let's make it relevant for our patients.
Good day. I'm Sujit Rajan, respiratory physician at Bombay and Bhatia Hospitals in Mumbai. COPD is a disease we deal a lot with. It's the third largest disease when it comes to mortality in the world today. COPD is the second largest non-communicable disease. We see a lot of COPD and we need to do a lot.
We're live.
Hello friends, good morning. So today on the occasion of the World COPD Day, which we celebrated yesterday, with the theme as Your Lungs for Life, we are having this patient awareness session on living and coping with COVID, living and coping with COPD. So myself, Dr. Vishweshwaran, I'm a senior consultant interventional pulmonologist and sleep medicine specialist at IHW Hospitals, Somajiguda in Hyderabad. And to have this discussion, we have an eminent pulmonologist all the way from Rajasthan, Dr. Seetu Singh, who is the director of ILD clinic as well as the head of respiratory department at Rajasthan Hospital in Jaipur. So, without wasting much of the time, we will go into the session where we will be trying to understand from Dr. Seetu Singh, like what COPD really is and how it is impacting the patients on day-to-day basis and what we really need to do to get over this crisis. Welcome, ma'am, for the program, and we'll start off with the first question, like what is really COPD all about and how prevalent is it in an Indian population?
So, thank you, Vishwesh, for the wonderful words of introduction. And dear friends, it is my honor and privilege to be here. So, this is a very important topic of COPD because, especially in our country, the burden of COPD is very high. It is the number 2 killer in the country. And if you look very carefully, the Rajasthan data, it is number 1 killer. So we have a disease with a very high mortality rate. Lot of morbidity is also associated with the disease. So one of the thing, what is this COPD? So it is a chronic inflammatory disease in which the airway, there are small airways like this bronchi, and this causes a blockage of the airways, which leads to difficulty in breathing in and difficulty in breathing out. So this is consistent of 2 components. COPD has one emphysema, and on the other component is the chronic bronchitis. These patients usually have a lot of difficulty in breathing, cough, chest tightness, and subsequently other symptoms.
So as Dr. Seetu Singh has rightly put, so COPD for all the public here consists of 2 major spectrums. One we call it as an emphysema, another is called as a chronic bronchitis. And it generally occurs secondary to the smoking. And as ma'am has already said, this is one of the most important causes of chronic respiratory disorder and ranks almost second in the world and even in first in few of the states of India. So it is very important that we are aware about what is really COPD about. So moving on further, ma'am, like how do you really differentiate a COPD from an asthma? Because many patients comes to you with the same complaints of breathing problem, with same complaints of cough. So when do you really call it as an asthma and when do you really relate it to a COPD?
I think this is a very important question, Dr. Vishwesh, because many of our COPD patients actually call their disease as asthma. So we actually did a study in one of our conferences and found out that patients wrongly label their disease. Almost 20% of COPD patients call their disease as asthma. However, these two are very different diseases. The treatment is also quite different. So asthma on one hand occurs in young. COPD on the other hand occurs in elderly, at least an age of more than 40 or more than 50. Second is asthma patients have a lot of allergies to like dust or environmental triggers. Next, this COPD patients may have increase in symptoms during particular months, but it is essentially remaining throughout the year. Asthma is associated with other allergic diseases like runny nose, itching of the body. However, COPD patients are not associated with such. Asthma sometimes get better. So our asthma patients, I feel that I don't have any disease at all. COPD on the other hand have persistent symptoms and it is a more severe form. So even the treatment is a little bit different. We give one type of inhalers to COPD and another type of inhalers for asthma.
So for the public here, so asthma and COPD are 2 totally different diseases. So if you are having a breathing problem which comes occasionally with change of seasons, and if you are having associated allergic symptoms like sneezing, running nose, then probably you are suffering from asthma. But let's say that you are having difficulty in breathing on day-to-day activity and you are a smoker and you are more than 40 years of age. So probably you are not suffering from asthma and you are suffering from a chronic respiratory disorder, which we refer to as a COPD. So moving on to the next question, in which age group do you generally see COPD being more prevalent, and in which age group you feel like asthmas are more prevalent? I think you touched upon it in the last question, but again, for the interest of the audience.
So, just quickly brushing through, asthma is more in a younger population, even children have it. However, COPD is a disease of at least elderly more than 40 years, at least, or more than 50 years. Some subtype of COPDs which have a genetic component, like very rare subtype alpha-1 antitrypsin that occurs in young, rest COPD occur in elderly.
So for the public here, so any patient more than 40 with smoking or with any other risk factor, you are probably dealing with COPD. Any person who is young and who is having seasonal breathlessness, probably are dealing with a case of an asthma. And as you have touched upon, ma'am, like what are the risk factors for developing COPD? Is it only occurs in does it only occurs in smokers? Because you are saying something called as a genetic like alpha-1 antitrypsin. So can it occur even in a non-smoker, or is it only a smoking-related disease?
So, very important question, and we need to identify the cause so that we can remove that and stop the disease progression. So, one is smoking, and smoking means cigarette smoking, bidi, tilam, hookah also. So, there is a common myth that hookah, the water purifies all the dirt and all the bad particles of the smoke, but it is not so. Even hookah smoking causes more exposure to the bad gases of the smoke. We did a study and found that the exhaled carbon monoxide in patients smoking hookah was in fact more than that in cigarette. So all forms of tobacco smoking leads to COPD. The second aspect that you were talking, Dr. Vishwesh, was the non-smoker COPD. So we have biomass fuel exposure, which is very important, especially in the rural areas, especially in women. So how do they get COPD? Either by passive smoking, that is the second-hand smoke, or due to the biomass fuel exposure that occurs in the rural areas of our country. The third is now the rising trend of air pollution, especially in major metropolitan cities and parts of Punjab and Haryana, where there's a lot of crop burning happening. So the last component comes is the genetic component, where diseases such as alpha-1 antitrypsin very rarely contribute to some subtype of COPDs.
So to put it in a nutshell, all that you have to remember is COPD is no more just a smoking related disorder. It can occur even amongst people who are non-smokers, as madam has rightly said, amongst patient who has got a biomass fuel exposure, especially cow dung burning, or even with respect to passive smoking, or it can occur because of high levels of indoor and outdoor pollutions, or very rarely because of genetic disorder. So any patient more than 40 years, be it a smoker or a non-smoker, who experiences chronic breathing, difficulty in breathing, you need to consult your doctor, because you may be a patient of COPD, and timely management and diagnosis really makes a difference in these patients. So what are the signs and symptoms of COPD? How do you evaluate a patient of COPD when they come to you? What you look for in those patients?
So basically, patients present with long-standing history of cough. So initially they take some antibiotics, they do not improve. And that is what a long-standing cough, difficulty in breathing. Along with the cough, there's phlegm also, sputum or expectoration as we call it. Along with that, there is some chest tightness, some noisy breathing, recurrent exacerbation. So they tend to get infections frequently. Very rarely, they may have some blood in the sputum also. Patients are cachectic, they have low energy. So these are the symptoms, and along with, their complications, they may have other symptoms like a chest pain or difficulty in lying down, breathing more affected when they lie down.
So when you are really worried, like what are the red flag signs and the symptoms when a patient comes to you with COPD? When do you really feel like, okay, this patient along with COPD has also some sort of a serious disorder like a tuberculosis or a lung cancer? When do you suspect?
So this is a very, very important question. And if you have COPD, the things is that if you have an increase in cough, the sputum becomes yellow, the phlegm becomes yellow. There is increase in the difficulty in breathing. You are not able to lie down. You have phlegm which has some blood mixed with it, when it can be due to a second complication such as lung cancer, or it can be tuberculosis. This is when you need to contact the doctor, when you are running high grade fever which is not getting. So this is the time your fingers are getting blue, you are getting more sleepy, more drowsy. These are the red flag signs, and you should contact your doctor immediately.
For the interest of the viewers here, so any COPD can present as difficulty in breathing while walking or while climbing up the stairs. It can present as a patient who is having continuous cough, not responding to a regular course of antibiotics, or it may be manifested as a person who is having a lot of phlegm production. And whenever you have a patient suspected of having a COPD, if you see that the patient is having some bleeding in the sputum, or if the patient is having a significant loss of weight, or the patient is having a significant loss of appetite, or if the patient is not responding to your commands and he is remaining drowsy, or you feel that right now we have a lot of access to this pulse oximeters, if you feel that the saturation levels are less than 92, then make sure you contact your doctor immediately, because these are the red flag signs. And if you pick up the patient very early, then they can be saved from going on to further interventions like ventilators and so on. So having known about the COPD and the red flag signs associated with COPD, do you feel like your COPD patients are more prone to develop lung infections? And if so, what are the precautions they need to take to protect themselves from lung infection?
So as we know, the smoking affects the lung, and this causes a damage to the lung. These are not healthy lungs, and they are very prone to infections, especially like a viral infection, which may be in the form of influenza, swine flu, COVID, and other many respiratory viral infections. The second important segment is the bacterial infections, which include a lot of things in the community that may not cause an infection in a healthy individual. The third component comes is the tuberculosis. So these patients are also very prone for tuberculosis. Not only they are prone to a more severe infection, which may require hospitalization and even a ventilator, as you had just mentioned. So infection along with more severity.
So, and since we know that the COPD is smoking related, do you think it is really a treatable and a preventable disease? Like, and if so, like, what are the medications and what sort of medications you advise, and what are the steps that a patient has to take to prevent them from getting recurrent infections of the lung?
So, yes, COPD is a preventable disease. You remove the noxious material, the smoking, the pollution, and probably you can prevent the disease. It is a treatable disease. Now we have a more positive attitude towards patients with COPD. We have a lot of things to offer them. So these are the patients whom we can offer treatment in the form of pharmacotherapy, the inhalers, which are the best medications. And second component is, the pulmonary rehabilitation, which includes exercises and subsequently vaccination, smoking cessation, a proper diet. So it is a holistic approach which includes medicines as well as the rehabilitation of the patient.
So for the viewers here, unlike the past where COPD means that you are going to suffer for life, it is no more the case. The science has developed. The experience we have gained has clearly shown us that COPD can be prevented. All that you need to do is stop your smoking the day before you develop a COPD, or once you are diagnosed with a COPD. Anytime you stop smoking, it is going to make a huge impact in your lifestyle and in the control of the COPD. Try to avoid yourself from getting exposed to the indoor and the outdoor pollutions, and make sure that you get vaccinated, because we know that the COPD patients are more prone to develop infections with influenza and pneumococcal. So get your yearly shots of influenza vaccine and pneumococcal vaccine as prescribed by your healthcare professional. And the myth is inhalers are the best treatment for COPD, and that is a fact, not a myth anymore. Like previously, we used to think that the inhalers means patient is going to get addicted, he is going to be addicted for life. No, the inhalers are the best ways of administering medications to your lungs, and that has to be taken if it is prescribed by your healthcare professional. And apart from this, as Dr. Seetu has already pointed out, you have a lot of non-pharmacological treatments like rehabilitation. Just like you have a fracture, you go for an operation, and then you start rehabilitating for your limb. Now your lungs are affected, and there are effective ways of pulmonary rehabilitation. And we also have a lot of non-surgical, non-pharmacological treatment, like you can have some bronchoscopic procedures, some surgeries to tide over this crisis of COPD. So let us remove this nihilistic attitude that once you are diagnosed with COPD, you are going to suffer for life. That is no more the case. We are seeing patients with COPD living their life healthy as well as with a better quality of life, provided they follow all these precautions. And again, to stress upon the point, Dr. Seetu, like, what's your take on this inhalers? Do you still feel that the patients are reluctant to use the inhalers? And what is your advice for such patients who still believe that inhalers are a taboo and inhalers have an addictive potential and all those things? We know that we have moved away from all those things, but what do you see in your clinical practice?
I will just share with you my experience from yesterday. There was this patient who walked in. She had severe COPD, had been an ex-smoker, and she told me, "Doctor, you give me anything other than an inhaler. I am ready to take as many pills as you want me to." So, even at this age, when, we are moving forward, there are a lot of people who have that stigma. Inhalers still have a lot of stigma across the country. There is a taboo that if you are being started on inhalers, then it will not be removed. You will have to take them lifelong. They are very addicting. So I would like to emphasize, as you had just mentioned, that there is no addicting phenomena with an inhaler. Inhaler, what happens is, sends the dose of the medicine right in the lungs where it is required. So how do I explain? If you have a bronchial obstruction, the medicine will be delivered right where it is required. There will be minimal absorption in the blood. There will be minimal side effects. Their dose used in the inhaler is 1/10 the dose. So if you take a pill, the dose will be 10 times more. The side effects will be more. The effect will be delayed, and it will be not as good as an inhaler.
So this is what the viewers has to take away from this session, what we are currently having. Inhalers are the treatment, and in fact, the best treatment that you can offer for a patient with COPD. There is no addictive potential with the inhalers, and inhalers helps in effective deposition of the drugs into your lungs, thereby preventing the side effects that you may face while taking the medications in the form of tablets or injection. And once you start using the inhalers properly, that is when you really start feeling the benefits of the medication. And a patient who is crippled for life can go back to his day-to-day activities and can perform the day-to-day activities on a much better scale. So before we conclude, there are two more questions which I would like to ask Dr. Seetu. Like, how frequently should a patient of COPD come to visit a doctor? And if so, what are the non-pharmacological precautions which he has to take at home? Like, what do you advise him at home? Like, already we have touched upon, but again, I want you to stress for the interest of the public.
So, depending on the severity of the symptoms, you have to consult your doctor. So if you are having a lot of symptoms which are not getting controlled, you may need to visit your doctor more often, say 10 days or 15 days. But if you are having a stable disease, you may need to visit your doctor every 2 months or 3 months on a stable inhaler therapy. The precautions that you need to take is, I will still emphasize, quit smoking, quit all exposures to toxic fumes like biomass fuel exposure. The second part is, take your inhaler regularly, don't hesitate. Third is, get yourself vaccinated against, swine flu vaccine, COVID vaccine, and the pneumococcal vaccine. The fourth part is, take appropriate diet. Nutrition is very important. You have to take a good protein diet, good vegetables and fruits to prevent infections. The last part would be, good exercise. Even walking is a very good form of exercise. Keep doing that, because that improves exercise capacity. You will be able to have less dyspnea, more exercising, and you will feel happy, because exercise releases happy hormones and you will be happy and that will improve the outlook that you have towards your disease.
So I think we are coming to the end of the session. So just to put things into perspective for the viewers here, COPD is a preventable disease. You stop smoking, you move away from the noxious stimuli, you can prevent yourself from getting COPD. It is very much a treatable disease. You got a lot of medications like inhalers, like non-pharmacological therapy, like rehabilitation, like bronchoscopic interventions. You can go for surgical management of COPD. And these days, we are also coming up with lung transplantation, which is providing a new lease of life for patients of COPD who are on oxygen or on continuous NIV, which we call it as non-invasive ventilators. And third thing is you need to make sure that you are compliant on your medications. You need to make sure that you are getting yearly vaccinated with influenza and pneumococcal vaccine as per your healthcare professional. And as Dr. Setu has already stressed, taking all the good healthy lifestyle habits like proper walking helps you to prevent from going into deconditioning, nutritious food, keeping yourself hydrated, and looking for the danger signs like worsening of your breathing problem or cough or yellowish discoloration of the sputum, or in case if you start developing bleeding while coughing, or if you start having chest pain, then these are the red flag signs where you really need to consult your doctor immediately. And to end the meet, all that you need to understand from this meet is inhalers are the best line of treatment that we have for COPD, and there is no taboo that you should not be using an inhaler. And inhaler helps you in better drug deposition into the lung with minimal side effects. And I would like to again thank Dr. Setu for taking her time to enlighten the public as well as us for all the things that we need to really understand about COPD. So let us stop smoking and let us start leading a happy and a healthy life. Thank you.